All right. Well, hello. We are just moving right along with our NC Breathe Conference 2021. We're about to start our panel discussion. We're focusing on looking forward, mitigation, adaptation, and resilience. In the interest of time, I'll keep the introductions brief, but please feel free to find more details about our panelists in the speaker section on Whova. So I would just like to welcome Rame Hemstreet, Vice President of Facilities Operations and Chief Sustainable Resources Officer at Kaiser Permanente. We also have, as one of our panelists, Dr. Jennifer Runkle of the North Carolina Institute for Climate Studies at NC State. We have Baja, Kristin Baja, Program Director for Climate Resilience and Equity at the Urban Sustainability Directors Network. And Max Cawley, Educator, Researcher, and Program Manager with the Museum of Life and Science in Durham, North Carolina. Thank you all for being with us this afternoon. We will be entertaining questions at the end. For our audience members, we're not using chat, but feel free to share your remarks or your questions under Q&A in this webinar, and we'll get to the questions at the end. But first, I'd like to invite Rame Hemstreet to share his experience with climate change mitigation and resilience at Kaiser Permanente.
Thank you very much. Hello, North Carolina. Greetings from San Francisco. So I'm gonna, in the next 10 minutes, try to accomplish three things. One, tell you about how Kaiser Permanente became carbon neutral last year. Second, talk about how we're dealing with the consequences of the climate crisis. And then finally, give a brief future cast, which is really sort of current events here in California, but current events here tend to become future events elsewhere. So as you can see, we've been on a journey over the last decade to try to do no harm. About 10 years ago, we made our first commitment to reduce our carbon footprint. And that eventually culminated last year in becoming carbon neutral. We did that through a number of means. Number one, of course, is energy efficiency. We've reduced our energy intensity about 8% over the last 8 years or so. But because we've been growing, adding members, adding facilities, the total emissions of Kaiser Permanente has actually gone up over that time. So to compensate for that, there was a multi-pronged approach, and the three key initiatives were, number one, what are called virtual power purchase agreements. Here in California, we signed long-term offtake agreements for 4 large-scale new renewable energy projects. 3 of those projects are now completed. One of them includes battery storage at scale, which is very exciting. That has essentially compensated for our Scope 2 emissions in addition to the on-site solar that we've installed. So we also have a very large portfolio of on-site solar electricity production. And then finally, the third large initiative was to identify a portfolio of appropriate carbon offsets to offset our Scope 1 emissions and a portion of our Scope 3 emissions in order to achieve that carbon neutral protocol certification. We've done all this in the context of affordability. The most important thing for Kaiser Permanente is to provide high quality, affordable health care. We think we've achieved carbon neutrality without increasing cost. In fact, we've decreased our unit cost of energy over the same period in which we've achieved carbon neutrality. So that can be done under the right circumstances. But the circumstances are certainly different here in California, the regulatory environment, the cost of electricity. So there are certainly factors that have made it a lot easier for us in California than it might be in other parts of the country. But you know, this is the reason we've done this is it supports our goal of total health for our community, for our communities. In addition to affordable, high quality health care, we're also committed to the improving the health of our communities. And there's no larger health threat to our communities than climate change. And that's becoming, becoming quite apparent in the events of the last few years. While the climate crisis is the prototypical tragedy of the commons and a very important but long-term problem, we now have an urgent problem here in California and elsewhere that's been exacerbated by the climate crisis, and that's been, you know, the wildfires that have occurred and the safety shutdowns of the grid that have resulted from those wildfires. So now we're coping with adapting to the impacts of climate change, and at the same time trying not to exacerbate the root cause of those impacts, which of course is burning fossil fuels. So we've been doing a lot of work on green microgrids. Here's a brief history of green microgrids at Kaiser Permanente. Of course, you know, we've long had microgrids at hospitals. They're the source of generation or diesel generators. But with the cooperation of the California Energy Commission and funding from the California Energy Commission, we installed a green microgrid a few years ago at our Richmond hospital, which doesn't eliminate the need for those diesel generators, but provides a second line of defense. And it was essentially a pilot project to demonstrate that a green microgrid was feasible. So it became the first microgrid at a California hospital and allows us to island a portion of the facility using the electricity generated from the solar panels and then stored in the battery. So now we're scaling up that effort at our Ontario hospital and essentially about 10 times the scale of the original installation in Richmond. And in this case, we are expecting once this project is completed that it will become the first line of defense in the case of a power outage and allow and assume most of the hospital's load. This project is also using a new type of battery, zinc hybrid rather than lithium ion, that has some advantages, including environmental advantages. So we're trying to scale up this effort and start to utilize both fuel cells and PV plus storage in order to improve the resiliency of our hospitals without exacerbating the climate crisis. So we have a couple of more such projects in the works. Finally, let me talk to you a little bit about the future. You might have seen last summer during the wildfires, Governor Newsom here in California announced that California has the goal of, by the year 2035, no longer selling gasoline-powered vehicles in the state of California. I think at the time that was probably ridiculed in many circles in other parts of the country. But then a few months ago, GM announced that by 2035, their goal is to no longer manufacture fossil fuel-powered cars. So, you know, we're preparing for that future. You know, there are different predictions as far as the uptake of electric vehicles, but Bloomberg is very bullish that the uptake is going to be pretty steep. And here in California, there are now new standards being implemented that we and everyone else obviously will be complying with for all of our new facilities that we're building that require EV chargers as a percentage of the parking at our facilities. And another aspect of the all-electric future, we have many municipalities in the state of California that are cutting the pipe, if you will. They are requiring that new facilities do not connect to the natural gas infrastructure. Now, each of these ordinances tends to be a little bit different and have a little bit different, some different exclusions. But the trend is clear, and we see this as an opportunity, not a threat, to pioneer all-electric buildings. So we built our first all-electric building a couple of years ago. It's been in use now for 2 years plus. It didn't cost any more. Part of the reason for that was the location was would have required a pretty long run of pipe, but nevertheless, the first cost was about the same as a typical medical office building. And you can see in the box there in the lower left, the operating costs are actually less than our typical medical office buildings. So this particular building got a lot of attention with DOE and other entities, and won a few awards. So we have yet to declare that all future medical office buildings will be all electric, but both the authorities having jurisdiction and our own initial efforts are pointing us in that direction. So that's what I have, and I look forward to your questions at the end.
Yes, thank you, Rame. And now we'll have Dr. Jennifer Runkle.
Great. I'm going to pull up my slides. Remy, if you could stop sharing, I may. Okay, perfect. Thank you. Okay, and let me get into slide view. All right, can everyone see my slides? So good afternoon. I'm going to switch gears just a bit, still be, in line with resilience, but more kind of research upstream, informing how we can be more resilient, particularly looking at the mental health impacts of climate change and extreme weather in young people. So in 2016, a close colleague and I, Dr. Maggie Sugg, medical geographer extraordinaire at App State, we partnered with Crisis Text Line, which is this really incredible national nonprofit that provides anonymous, free, and 24/7 text-based platform for anyone in crisis to text in and get connected with a counselor. We've done a number of research studies looking at this data from suicide contagion in adolescents, looking at crisis response patterns during higher than average temperatures, even looking at the impact of COVID-19 on young people. Anyone can use the service, but it's primarily children, adolescents, and young adults who are kind of high volume users. So colleagues and I thought, wonder if we could leverage this really unique data source to get a sense of how youth were responding to Hurricane Florence in the Carolinas in close to real time. To our knowledge, no other research group has actually leveraged crisis platforms to kind of get a sense of how young people are experiencing an extreme weather event. And so we set out to look at changes in help-seeking behavior for youth in North and South Carolina before and after Hurricane Florence hit in 2018. I'm sure for many of us in the Carolinas, the storm was very memorable. Let me just adjust my screen. Rainfall from Florence was, over 3 days was a 1,000 a year event. We had upwards of 50 inches of rain in some areas. It dumped 8 trillion gallons of rain over the Carolinas in a short time span. And actually, the cost of Florence exceeded Matthew and Floyd combined. And so what we decided to do was conduct a using a quasi-experimental research design, examine pre and post changes in crisis text volume for 4 outcomes: a text for any reason, stress and anxiety, depression, and suicidal thoughts. So essentially, after a crisis counselor and the texter finish a conversation, the counselor will go in and geotag and kind of transcribe each of the issues that were addressed during the text conversation. And so this is how we arrived at these 4 outcomes. Oops. So essentially what we're looking at here for these 4 panels is crisis text volume for young people. And the upper left quadrant was for any reason, B, anxiety and stress, lower left quadrant, depression and suicidal thoughts. And you'll see that there is an increase in depression, but a really significant increase in this 2 light parallel lines is when Hurricane Florence happened. And we saw a pretty immediate and significant increase in text volume for anxiety and stress, and for suicidal thoughts, which was actually something we were really surprised by. And because no one has yet looked at this data, we decided we better validate it with emergency department volume. So we had NC Detect emergency department visits for North Carolina residents, and we did use the same interrupted time series analysis and found that the ED volume change actually corroborated what we were seeing in crisis text volume. So again, we saw a really significant spike in anxiety and in suicidal ideation. I actually blew up the time series because it gets, I'm sure it may be small on your end, but essentially a 23% increase in crisis text volume for suicidal thoughts. And this is actually primarily research from Katrina and even Hurricane Andrew. Using surveys and psychometric evaluation has typically or traditionally documented an increase in suicidal thoughts six months or so after the event. And so we were one of the first groups to kind of see this initial immediate impact. And we saw the same for ED visits, a 33% increase. And for the stress and anxiety piece, that's particularly concerning because chronic stress and anxiety is actually an important predictor for longer term PTSD and other adverse mental health outcomes in young people following a natural disaster and extreme weather. So what we found is that this novel data source is actually a feasible way to gauge how young people in close to real time and even geographic hotspots of help seeking. This can be leveraged for situational monitoring in the public health community. We did see an increase in help seeking behavior for youth in the Carolinas, and we were able to validate that with the emergency department visit. So, there's really, this data is kind of twofold. Not only can it provide situational monitoring, but it's also a really low cost way to kind of bridge the divide between, in the aftermath of a large scale event, there are discontinuity or disruptions in mental health services. And so this actually may be a bit of a safety net to allow the individuals impacted to get some of the mental health support that they need. And they can do it anonymously. So that's really important for young people, decreases who, there's a stigma for seeking care, and there's also a cost. And so we have kind of moved into wanting to look at the large wildfires in California and see, what else we may be able to use this data. But this is kind of high level what we found, and I will pass the baton to the next speaker.
All right, I think it's my turn. So I also will jump into PowerPoint here, so give me a second. All right, so I was asked actually to speak about resilience hubs and some of the work that's happening in the network around resilience and resilience hubs. So before we begin, I just want to acknowledge that I'm standing on the land of the Piscatawada and Nantengo people here in Baltimore, Maryland, and acknowledge the painful history of genocide and forced removal from this territory. Second, want to acknowledge I'm a white woman in a privileged white body, and that I have unearned privilege that I did not earn just based on my skin color. Third, just want to thank my fellow panelists for the opportunity to be here today and all the people who put this together. So the way that we are looking at resilience in the network I work for, which is the Urban Sustainability Directors Network, is we are really looking to reject the cookie cutter approach, to get out of the same sort of methods or the same sort of ideas for everyone, and move away from the damaging sort of emergency response and recovery cycle, and instead start to think about adaptability, flexibility, and a no one size fits all. And so in that, we are reframing the way that resilience is really considered. I know a lot of people, especially in the National Oceanic and Atmospheric Association, talk about resilience as bouncing back. But we're certainly not where we want to be now. And so it's important to understand that this version of the definition really doesn't think about people and enhancing quality of life and thriving. And that's something that's really important around resilience. And so we really have reframed it to think about thriving, enhancing quality of life, thinking about reliable systems and economic vitality as part of the work. And that is the core for the way that we then approach resilience hubs. And so how resilience hubs actually got started is I used to work for the city of Baltimore as the climate resilience planner. And we did follow a lot of the cookie cutter approaches. We were told this is the way you do a resilience plan. This is the way you should do preparedness planning. And back in 2014, as we were doing this with folks, they kept saying, are you crazy? We have no trust. We do not want to come to your emergency shelters. We do not want to participate in these events. The city has let us down. And so what we did is actually shifted our approach to think about listening sessions and going out and getting to know people better. And we put a big pause on stuff and focused on relationships. And in that, we sort of co-developed with the community the idea of resilience hubs, of having these sites that are already well trusted in neighborhoods that people will go to all year round, not just in the event of a disruption. And so what this has turned into is essentially these being community serving facilities that are augmented to support residents and to shift power willingly from government into the hands of community members and community-based partners. The idea of shifting power is more self-determination. Folks are not then relying on local government to be there in the event of a disruption or kind of year-round. As we've seen with COVID this year, these long-term disruptions, there's a lot of needs through those disruptions. And so it's not just the shock event, the hurricanes and the other big floods, but it's also this sort of short and long-term. So a hub does consist of a building or a set of buildings. That's why we try to make sure we set some guidance here. And it's really focused on making sure that holistic everyday needs are being met, but we're also retrofitting and considering disruptions and recovery. And we're thinking about backup electricity and access to food and water, charging stations, but also looking at community cohesiveness and thinking about those relationships as the core foundational component. And I'll mention the Chicago heat wave that happened back in the 90s. This was a huge piece that helped determine whether or not people survived or did not survive that heat wave, because it was the community connectivity, it was the community cohesiveness. And so reframing resilience is really bringing in community-based approaches and community respect as part of that process. I will say that resilience hubs in themselves are what I say kind of like snowflakes, or they're very adaptable and flexible. But we do have 5 foundational areas that are what help us align the work and also help us align funders and other partners. These are the 5 areas. I'm not going to read them to you. I'll go into them in a little bit more depth. But essentially, these provide that framing, but we also build out a lot of adaptability into these spaces so that each of the community's needs and well-being is considered, and it's adaptable and flexible to what they want. I did mention our definition of resilience, but we also think of resilience in 3 different modes. So thinking about sort of the fact that every day we need to be resilient. We need to be thinking about how our communities are going to become more resilient. And that's a lot of where we see this preparedness work, but then also some of the connectivity around energy and weatherization and energy efficiency and other work that can be put into this non-disruption sort of space. The other components then are thinking about disruption and how are we in these sort of modes, these short-term disruptions, as I mentioned, the sort of hurricanes or big events, but also the long-term disruptions, and then integrating the process of recovery into that. So we break resilience into these modes to help with resilience hubs and also to help ground where different services and needs need to go and when they're thinking about which mode they're going to be most utilized in. We do a lot of trying to make the case for resilience hubs, focusing on a targeted universalism approach, which is from the Haas Institute in Berkeley, essentially saying that all people's needs matter, but we do need to be focusing in on the needs of people who have been chronically underinvested in and disenfranchised because of racist policies and practices. And focusing not just on that acknowledgement, but also how are we shifting power and capacity to communities through the resilience hubs themselves. So there's a big return on investment that we're starting to document and be able to put numbers to related to stability, related to job training, related to some of the other considerations of what can happen at these hubs. This is just an image of some of the workshops that we do, these 5 foundational areas around a hub itself, and then identifying those different function modes and thinking about where people would want to be if they're thinking about what the baseline for the hub needs to be, and then also what the most ideal option would be. So we kind of look at baseline as the immediate components that are needed to have the site function as a resilience hub. Not a shelter, not an emergency site, but a full resilience hub. And then we have the sort of optional of what do community members want to see? What would they like to see in the next few years? Where are some of these big opportunities? And then ideal is what would it be if we had billions of dollars that came into this community? What would this site look like and how would it look? And so when we're focusing on things like services and programming, this is one of the 5 foundational areas. We're thinking, what do community members need and want from this site? What is missing in the neighborhood now? How can we create the spaces to meet those basic needs and also really think about opportunities for training and job opportunities? So is it a tool shed or tool checkout? Is it a maker space? A space for children to come and connect and do youth programming or senior programming? And then other things like human health benefits, food security, childcare, et cetera. The second big foundational area is actually communications, and communications in all 3 of the resilience modes. So how are we proactively connecting people and building trust with each other? And how are we ensuring that people feel like they're part of the community? This isn't just about putting in Wi-Fi or having connection to folks after a disruption. This is all year round thinking about that communications. And so the proactive relationship building, but also building in some of the systems and the infrastructure that we need to be able to communicate in the event of a disruption. The third is in building and landscape. We're thinking about safe spaces, community supported spaces. These are typically sites that already exist that need to be retrofitted. We certainly are thinking of things like air filtration and air quality, access to heating and cooling, storage of supplies, and then the connection to the landscape and the way that it can be a connection to nature and green space, which I think connects to the mental health components that Jennifer just talked about. Certainly power systems and resilient power systems. I heard that spoken about by the first speaker and just thinking about these hybrid solutions and battery backup solutions. So thinking about renewable energy and battery backup. And then the last piece is really around the operations. How will the site actually operate? Does it have the ability to serve all members of the community? How are we thinking about security and safety? There have been a lot of people asking how hubs have been used during COVID. So there's a link to an article that was written if you're interested in learning about how hubs were used during COVID. And then there's also a website with a lot of resources about what these are, why we want them, and how to go through creating them. And a lot of resources that have been developed to help with just getting more familiar beyond this 10-minute rush course on resilience hubs. The one thing I will say though, as I mentioned this before, hubs are really unique. They come in many different shapes and sizes. They're adaptable and flexible and have a lot of unique elements. So the main thing I want you to take away from this is that they are not emergency shelters. They're not just for disasters and disruptions. We're thinking about this holistic paradigm shift. And I believe that is the end of my time.
Hey there, folks. I am going to start my PowerPoint. While I do, thank you. Let's see. Thank you so much to Clean Air Carolina for the invitation to be here today. I want to acknowledge that the work that I'm about to share is the result of a small partnership that we are hoping to expand largely by virtue of being here today and talking with all of y'all. So I'm really, really excited to be here. My name is Max Cawley. I work at the Museum of Life and Science in Durham, North Carolina. I am here also with an invitation, and that invitation is to join us as part of a new project we are launching this summer. So we're in the very early stages of design of this project, which I believe is the exact perfect time to start to talk about it here. So I suppose rather than talking about a successful previous resilience strategy, as the name of this session implies, I'm actually here to invite everyone to join us in being a part of what we hope will be a successful resilience strategy around extreme heat in urban areas, specifically in Raleigh and Durham. There is good reason to be hopeful. The ambitious project that I hope you'll embark on with us has been impactful and influential, not only in building new knowledge about local and hyper-local impacts of extreme heat, but also in building resilience, fostering, establishing, and strengthening partnerships, and advocating and creating policy, action, and infrastructure around making cities more equitable, just, sustainable, and livable for everyone. And the key here is that for many people, our cities are not those things. Data from the type of study we are going to do, which I promise I'll talk about here in just a moment, suggests that when it comes to environmental and climate phenomena like extreme heat, we are living in cities that are not equitable, not just, not sustainable, and tragically not livable for many people. The disparate impacts of extreme heat are disproportionately dangerous to poor communities, to Black communities, to Latinx communities, to communities that Indigenous people and people of color inhabit, to communities with higher levels of undocumented people. These communities are not only more likely to be literally hotter because of the built environments around them, and in many cases the lack of green space to mitigate that heat, but also the least invested in around preparing for heat, making for a terrible convergence of higher risk of heat-related illness and death. Before I go any further, I want to acknowledge that a lot of what I'm going to talk about is built off of the work of Dr. Vivek Chandas from Kappa Strategies, and also my friend and colleague from the Science Museum of Virginia, Dr. Jeremy Hoffman. Now, the South is hot, and extreme heat events in a warming world are projected to increase here across a lot of different metrics. Average daily maximum temperature, let's see right there, days over 95 degrees, days over 100 degrees, days over 105 degrees. Minimum temperatures and nighttime temperatures are all projected to increase in our region over the coming decades. This next one is one of the scariest ones to me. If you look at the higher emission scenario, you'll see that we are potentially looking at reaching around 140 days per year where the temperature will reach into the 90s. In short, climate change is projected to increase the number, severity, and duration of extreme heat events in North Carolina over the coming decades. So in that way, extreme heat is a climate change phenomenon. But it is not only a climate change phenomenon. There are many other intersecting factors that play into how we experience extreme heat, how vulnerable we are to extreme heat, and how dangerous or potentially lethal extreme heat may be to us. These factors, like how much concrete, asphalt, or impervious surface you live around, how many shade trees are in your neighborhood, how socially well connected you are, whether you or your neighbors have health insurance or access to a driver's license or a car, whether you can afford air conditioning or go somewhere if it gets too hot. These are all social and economic determinants of health that play directly into whether you see a hot day as a day to go to the pool, or whether you might be worried for your own survival or the survival of people you care about. These things are not necessarily stemming directly from climate change. They are stepping from a series of decisions that people made. Decisions that can be traced back to racism in policy, urban planning, and investment in communities that echo and reverberate to this day. Unfortunately, when the methodology and analysis that we're going to use here was applied in dozens of other cities across the US, that painful legacy of injustice, inequity, and continued disenfranchisement translates pretty directly to this day as climate risk and hazard. Put more plainly, poor communities and Black and brown communities are in general more at risk during extreme heat events than other communities in urban areas. Many determinants of heat vulnerability can be tied back to racist policy and planning. Extreme heat is not directly expressed evenly over an urban area. Residents of neighborhoods that were subject to government-sanctioned racist housing policies that we now call redlining, you can see Durham's red line here, will suffer the financial, social, and health consequences more severely than the rest of the cities they inhabit. Extreme heat is expressed through these decisions people made about land use and social and economic investment in areas. How people decided to develop and use land in local areas creates tremendous variation in how hot it feels on the ground. And how people decided to invest in communities creates variation in how unhealthy or survivable that heat is. The science here is relatively simple. Hard surfaces are hotter, shaded surfaces are generally cooler. Having one and not the other translates to risk. It's obviously a little bit more complicated than that, but there are some really wonderful sessions at this very conference that I have been to and that are coming up that will go into more depth about that. The legacy of this is not relegated to the past though. And depending on what metrics you use, the Raleigh-Durham area is one of, if not the most rapidly growing area in population in the United States. And it is also gentrifying extremely quickly. It's important to remember that heat affects environments, but it affects people as well. And people move, and sometimes not necessarily by choice. Important resilience and planning decisions must be made to protect people as well as environments when it comes to facing down the realities of a warming and thus more hazardous world. And make no mistake, extreme heat is hazardous. It is currently the most deadly climate event in the United States and causes more related injuries each year than all other natural disasters in the United States. Currently, there are about 3,000 ER visits on average per year for heat-related illness in North Carolina, and around 250 people die each year from heat-related factors. So the long and short of it is, extreme heat is a climate change issue. It is also a racial justice and social justice issue. It's an economic justice issue, and it's a public health issue. All of these overlapping contexts are an important reason why we need better and more local and hyperlocal data about extreme heat in our cities. So let's talk about what we aim to do this summer in Raleigh and Durham. So this summer, in summer 2021, we're going to embark on a participatory project to map extreme heat in the Raleigh-Durham area. This project is made possible by the National Oceanic and Atmospheric Administration, the National Integrated Heat Health Information System, or NIHIS, and CAPA strategies. It will follow a methodology developed by that public-private partnership and will run in a few dozen cities over the past few years. It will also be concurrently conducted in about 11 other states this summer. You can see on this map, this is where it was done last year and the year before that. We're actually so early on in the planning process that the press release has not come out for this yet. This information is not embargoed, obviously, but the map for the campaigns this year just doesn't exist yet. So you're getting a head start. On the day of the campaign, participants, so that's citizen or community scientists, some of whom we hope will be you, will collect real-time data, including ambient temperature and humidity, by fixing a monitor to your car or your bicycle. Data collectors will then drive or ride a predetermined route at a relatively slow speed for about an hour through part of the city. Around 15 monitors will all be deployed to drive and collect these data at the same time 3 times in one day. So one in the early morning, one in the afternoon, and one in the evening. So obviously that's a lot of people. We are in need of folks to join our project. The data collection for this study will take place all in one day, which we're hoping will be on one of the hottest days of the year. Right now, we're working with our partners at the National Weather Service in the Raleigh office to find a hot, dry, and clear day. But for now, we're fairly confident that the study day will occur in June or July. The data people collect will be used to develop a high resolution and granular temperature map and model of the Raleigh-Durham area, which will reveal the hottest and coolest parts of our region, and importantly, the extent of the temperature differences between them. Similar efforts in other parts of the country indicate differences upwards of 18 degrees Fahrenheit across the same region. And understanding where the most extreme temperatures occur and the extent of the problem is the first of many steps towards building resilience to extreme heat. All of our data will be made public once these maps and models of extreme heat have been made. And those will look a little bit like these. You can see Washington, D.C., Baltimore, and Richmond have all made these maps. These were all developed using similar methodology in other cities as part of this national campaign. You can see where it's hot, where it's cool, and begin to look for some other patterns. By having a granular map of temperature and a heat wave, we can intersect these maps with other maps of social and economic determinants of health. And together, these tell powerful stories that have been important tools for advocacy and building resilience in multiple other cities where this mapping project has been undertaken. Our aim is to make this project similarly useful, to collaboratively build new knowledge about local impacts of climate-exacerbated extreme heat in Raleigh and Durham with and for people who need it. I'm going to put up our brand new project website at the end of this talk with the links. And if it looks unfinished, that's because it is. This is the first time we've talked about this project sort of more publicly than with our small group. The press release, like I said, doesn't come out until the 14th. But we want to involve you, the stakeholders, community members, active members of groups already involved in this work from the earliest stages of putting this project together, because we want this to be something collaboratively and publicly owned and useful. Any and all types of involvement in this project are very cool with us, from signing up to the email list to stay apprised of updates, to wanting to organize groups of volunteers to collect data, or to figure out what we do with these maps and data once they are collected and analyzed. We know that this is the first of many steps. I also hope that you'll consider joining this project because there are so many more decisions that we can all start to think about now with what happens to these data after they're collected and what we do with those implications. One important lesson learned from resilience is that social isolation is exceptionally dangerous when it comes to climate-related events like heat. And this is one reason why community-based resilience strategies like buddy systems and check-in networks between neighbors are so important. The opposite of that lesson is also true. Partnership, collaboration, and engaged community in themselves are important resilience strategies. And that's a lesson we want to take with us through this project and a goal unto itself, creating new partnerships, networks, and friendships. This project is built around and will be most effective when we involve as many people as we can in all stages of this project, from designing the methodology to finding the people to collect data, to collecting the data, and then using, disseminating, and talking about what we find. Ultimately, the broader the participation on a project like this, the more political will that can be created around doing something about the profoundly unequal planning and policy that has existed for too long in our cities. I'm almost done, and I promise I have a whole lot of links to send out to y'all here. But extreme heat is here now, and we have to do what we can to advocate, understand, and build resilience now to this public health crisis. There are things we can start to do towards building resilience and directing, investing, and giving crucial resources towards righting the terrible decisions that got us to where we are now, and making better and more informed decisions about the future. Since I didn't have time to talk about all the necessary context and all sorts of details about the project, some of which do not exist by virtue of it being so early in the process, I've got a whole lot of links that I'm going to drop into the chat. And also, of course, if you'd like to talk to me more about this project, I'd be absolutely thrilled to talk with you. Thank you again so much.
Well, thank you so much to all of our panelists for the work that they're doing and all that they've been sharing with us this afternoon. We do have a few questions for you all, and this one is probably directed to Max. Have you thought about intersecting the heat maps with an overlay of air quality in the community?
Yeah, what an absolutely fascinating question. And I'm sure that there are cities that have pulled this off before, Baltimore being one of them, and actually San Diego being one of the other cities that's conducting this this year. I don't know exactly which specific cities have done that, but that's going to be a really, really fascinating thing that we can do once these data exist.
Great. And this question might be for Rame. When you were talking about the work with Kaiser Permanente, what can North Carolina learn from California?
Number one, I would say politics matters. We've been able to accomplish what we have because over the course of decades, and it used to be bipartisan, it's no longer here, but really beginning with Governor Schwarzenegger, we've put in place politicians and therefore policies that have enabled us to do the things we have at Kaiser Permanente. Now, what you can do short of that is, both personally and in your professional life, look for opportunities to reduce your impact. It all starts with conservation and efficiency. I'd like to say Kaiser Permanente has figured this all out on our own, and we've achieved carbon neutrality because of our efforts, but we really the foundation has been built by a couple of decades of policy making here in the state of California.
Okay, great. Thank you. Thank you for that. And this could be, I guess, a general question for any of the panelists, but how can the research community work to ensure local and regional resilience?
I can chime in on that one. I think for resilience, for us to kind of design effective and holistic resilience strategies, it really does have to happen at the local level. And I think that we, as the research community or the larger, maybe not even outside of research, but that's obviously where I'm hanging out. I think we have to partner with local communities and elevate their voices and actually have them help us design or actually define the problem and what they feel are those kind of inherent resources to address the problem. So I think starting local and just as Max is doing, getting those partnerships in place to make sure that there's a wide breadth of diverse voices represented in the process.
All right, very good. And I'm also noting that in the chat box, Max has updated it with various links for more information for our attendees.
Way too many links, but thank you.
No, that's great. And just be sure to like copy them or use them now for the attendees, because after we close this session, they won't be available. Before we move on to the short film, just a couple more questions that we have here. And this one could be from any of you. From your perspectives, what are the next steps for moving community level resilience forward?
I think that's an answer similar to what Jen just talked about, and also what Kristin talked about in that amazing presentation about co-creating alongside local communities. I also think that everyone on this panel had great and really inspiring talks about expanding our sort of definition of what gets to sort of count as resilience. The idea that resilience is only infrastructure or only things that are happening in sort of place-based ways, I think needs to change, and we need to begin to think more about how effective resilience strategy also includes things like bringing people out of poverty, investing in public education, protecting healthcare rights for trans youth in North Carolina. All of these things are important steps in building climate resilience also.
Very good, thank you. Anyone else about next steps for community level resilience?
I'm happy to kind of chime in. I think that right now there's a lot of use of language, adding in equity chapters or equity statements, or taking one equity training. And it's not something that can be added onto a process. We are a country that is grounded in policies, practices, and everything that has been created for one user group, and that is white male landowners. And until we're able to come to terms with that, until we're able to recognize that our processes can't be layered on top of, they have to be holistically changed, we're going to continue to fail in this space. Not to be a downer, but I do think as you're doing this work, a real piece is to look at power and how power has shown up historically, how it shows up right now, and what is your opportunity to shift power as part of the process and then switch the process throughout. This isn't going to be something that changes overnight, but it certainly can't be something we layer onto the inequitable structures we already have.
Very good, very good. All right, I'm just checking to see if there are any other questions from our audience. There was a request to just drop your email or contact information in the chat. And it looks like we are a little bit ahead of schedule. Any closing remarks from any of our panelists? Well, again, I just really thank you. We so appreciate the time that you took. I know some of you are even on vacation, but you still decided to join us for this afternoon. So thank you for your leadership and sharing this important work. And at this time, we are going to join in for a screening of a Sundance-supported short film, Do No Harm, from Healthcare Without Harm. It's a powerful video presentation. And then after the film, we'll take a break, and then please return to Whova, to the agenda on Whova, to choose which breakout sessions you'd prefer.
Like most doctors, I began my career by swearing my allegiance to the Hippocratic Oath. As a pediatrician, I was so proud to be part of the tradition of the ancient doctors who swore, in the same spirit as we do today, to treat the sick and protect them from injustice, and above all, to first do no harm. Since the times of Hippocrates, medicine has evolved in unimaginable ways. Inside our clinics, we've become brilliant at treating our patients' symptoms. But outside our walls, some of these illnesses are growing to epidemic proportions. Of course, we ask ourselves, what is making people sick in the first place? And why do they keep coming back? In our journey to diagnose and treat the body, we've been to the moon and back many times over, masters and explorers of the very small. But 20 years ago, some of us saw that to understand the problem, we had to take a wider view. From that vantage point, we saw thermometers, each containing enough mercury to poison an entire lake, piled up in our trash. From an even wider lens, we saw medical waste incinerators on our own properties throwing toxic fumes skyward. Dioxins and mercury from waste incineration fell to Earth, entering the water we drink and the fish and animals we eat, poisoning our bodies and the developing brains of our children. Our own fingerprints were all over the scene. We were contributing to making our own patients sick, all in direct violation of the oath we had sworn to do no harm. So we formed a coalition of doctors, nurses, and advocates to push back, and pushed healthcare to stand with our oath and clean up our own house. Today, only a handful of incinerators exist in the US, and mercury thermometers are going the way of the horse and buggy all around the world. But while you listen to me, the climate is changing, and the people we serve face perhaps the biggest harm of all. Now we need healthcare to be a leader within this widest scope. Look at healthcare's global footprint. We consume huge amounts of energy on every continent, contributing to climate change and air pollution that kills 7 million people a year. In the US alone, healthcare is responsible for 8% of greenhouse gas emissions. But here's our leverage. We are 18% of the US economy and 10% of the entire global economy. The changes we make really can move entire industries away from harm and set new norms that will positively impact our patients' health. Imagine, for instance, if healthcare fought antibiotic resistance by purchasing only antibiotic-free meat. Or how innovative solutions to eliminating waste, like biodigestion, could help power hospitals and reduce air pollution around the world. Healthcare could help make renewable energy viable. By choosing to turn away from fossil fuel, we would reduce the carbon emissions that harm our patients and our planet. We stand at a turning point in the course of medical history, and we can move to a tipping point. It's within our power and our mission. Dr. Martin Luther King said the moral arc of the universe bends toward justice. Join us as healthcare bends toward a more just and sustainable future, rooted in our original oath, do no harm.